Hi, my name is Llewellyn Moreland. My school project for this course is going to be based on clinical depression, and with an emphasis on clinical depression in the Black community. Uh, the reason for me choosing this topic is related to some of the stories I heard in the Black community, reading um, some articles, journals, some books, hearing stories, and just being aware of what was going on at a time period for blacks related to depression, and then also knowing about the history of the misdiagnosis of blacks and related to treatment for mental health issues and also for other medical issues. Okay, I want to get right into this. And just kind of lay out what I want to discuss. First, I'll start with the population. Nearly 13.5% of the U.S. population, that's roughly about 48 million people, identify themselves as black, and another 2.5, 2.7 identify themselves as multiracial. So that would be a mixture of a black race and another. Okay. As of 2015, 55% of blacks in America lived in the southern states. Another 18% lived in the Midwest, and 17% in the North, and 10% in the West. Okay. Historically, blacks have had some adversity with in the medical field, as far as, and that would include also mental health, uh, which had some emphasis that were related to slavery. Okay, some of the names: scapegoating, race-based exclusion, and this included health, education, socioeconomic, and just general resources. Okay, so there's always been a disparity in the black community. Okay, okay. People who are impoverished, homeless, incarcerated, have substance abuse problems, are at a higher risk of poor mental health. So that itself would encompass a lot of the African community. Okay, despite the progress that blacks have made and lower socioeconomic people over the years. Um, for blacks, racism has continued. For the other groups, just being able to have access to mental health and also other resources have contributed to some of the form of depression. Okay. Blacks, African Americans have a negative attitude based on stereotypes and the treatment, and so they have always had a rejection of, the professionals, especially related to doctors, um, uh, mental health people in those instances. Okay, historically and contemporary instances of negative treatment have led to the mistrust of authorities. Many of those who are not seen as having the best interests of blacks in mind. Okay, now clinical depression is more than life's ups and downs. Living with depression can take the joy out of one's life, and cause pain, decrease happiness, and increase sorrow. Okay, it is normal to feel sad when a loved one dies, or when you are sick. Okay, going through a divorce, having financial issues, financial problems, being sad that maybe the relationship isn't working out so well, and things like that. Okay, so it's normal that a person would feel blue or sad, and it is the problem becomes when it lasts for extended length of time. Okay, when it lasts for more than a few weeks and the person is struggling to continue with their daily life and suffering, this is a sign that they may be suffering from some kind of depression, and mainly it could be clinical depression. Clinical depression is not a sign that a person is weak or has any weakness. It is common yet serious. Medical issues contribute to clinical depression. Clinical depression is a whole body illness that affects your body, thoughts, and your behavior. Okay. Without treatment, symptoms can last for weeks, months, or years. Appropriate treatment, however, can help most people who have clinical depression. Okay, clinical depression can affect anyone. Anyone can experience clinical depression, regardless of race, gender, age, creed, or income. Every year in the United States alone, more than 19 million people suffer from some form of depressive illness. African Americans are overrepresented in that population uh, that are particularly at risk for some form of mental illness. Depression robs people of the enjoyment found in daily lives, okay, and can lead to suicide. A common myth about depression is that it is normal uh, for certain people to feel depressed. Older people, just based upon what they've gone through and how long they lived their life. Teenagers, new mothers, menopausal women, and all suffer from some chronic illness. You know, okay. The truth is that depression is not a normal part of life for any person, including African Americans, regardless of age or life situation. Unfortunately, depression has often been misdiagnosed in the African community. Myths about depression. The myths and stigmas that surround depression uh, create needless pains and confusion and can keep people from proper treatment. Okay. Some of the things that people endure would be hearing the negative connotations that why are you depressed? Why aren't you feeling better? If you people have gone through slavery, why can't you get through this? And then especially for uh, black women suffer from who suffer from mental disorders. Uh, it is a sign in the black community that they're weak and they're unable to function. And weakness in the black women, and especially in the black community, is seen as intolerable. Uh, they've heard things like maybe you should see your doctor, maybe you should take it to Jesus, or you should just get over it, or you're strong, um, and so things like that aren't really helpful. People with depression can't just jump up and snap out of it. Also spiritual support and family support and support from loved ones can be an important part of healing. But the care of a qualified mental health professional is essential. And the earlier treatment begins, the more effective it can be. Some of the symptoms that go along with clinical depression are they include cognitive issues, negative thinking patterns, biological and genetic factors, gender. It affects more than women than men. Clinical depression does. Okay, other medications, other illnesses, and situational factors. Symptoms that are present every day and last for at least 2 weeks, according to the DSM manual. Uh, is would be considered as major depression. The symptoms might include fatigue, loss of energy, nearly every day, uh, feeling worthless or guilty about something almost every day, impaired concentration, indecisiveness, okay, insomnia, hypersomnia, almost every day, a marked diminished interest and pleasure, and almost all other activities nearly regardless slowing down. Okay, reoccurring thoughts of death and suicide, significant weight loss or weight gain. Uh, for some, a number of these factors seem to fit, while others, uh, a single factor can cause illness. Symptoms of chronic depression due to cultural backgrounds, depression may exhibit differently among African Americans. Often people become depressed for some reasons and other than medical issues. Okay. Uh, and then some people also um, do what we call self healing. So they may use illegal drugs or alcohol. And even for some, it could be eating food or not eating food or uh, putting a lot of energy in other things like excessively working out, uh, monitoring their weight, working more hours than normal. All these things are an attempt to avoid dealing with the depression. And this might very well be common in the black community, especially when it comes to alcohol and drug uses, sexual explorations, risky behavior, and other factors. Many people in the black community avoid seeing professionals, and this goes back to what I initially said with having the mistrust and being misdiagnosed. Okay, So they avoid seeing professionals and getting help for depression. Uh, and some of this goes back even as far as into the slavery. Clinical depression is a treatable illness. The good news is that, like other illnesses such as heart attack, diabetes, other heart problems, clinical depression is treatable with the help of a healthcare professional. In fact, that over 80% of the people who do seek out professional help uh, end up with successful treatment. Treatment for depression, clinical depression, is it depends on the severity of the treatment, but primarily you would need to start with seeing your primary care physician, maybe seeing a psychiatrist, and then you could also be treated with drugs, antidepressants, uh, along with psychotherapy or talk therapy, which can address using the psychotherapy. You can address emotional issues, um, the negative thought patterns, things of that nature would help. Sometimes other medications are added to antidepressants to boost effectiveness. Certain medications work better for some people, and it may be necessary for the doctor to try different drugs and different treatments. And so, also that would go also with it with the therapist. That there may be a form of treatment that they may use. It could be CBT, cognitive behavior therapist. It could be psychodynamic. It could be situational. Different forms of treatment. So it's just up to the person to seek the help and get the help from a help professional. Okay, that's the end of that video.